And welcome back. And we're moving into our first conversation for today, focusing on HIV/AIDS in Belize. We have with us on set Antonia Coyoc, who is the Monitoring and Evaluation Officer for the Ministry of Health HIV program. And we're joined by Arthur Usher, who is the Communications and Programs Officer at the National AIDS Commission. Good morning and welcome.
Good morning. Thank you.
So we know that World AIDS Day is celebrated every December 1st, and it is a great opportunity to bring the conversation to the forefront as to the situation of HIV and AIDS in Belize. So let's use that as our launching point. What are we seeing in terms of the data as to how we're faring off with new infections and the quality of life of persons living with HIV?
Okay, good morning again. For the last year, 2016, we had a total of 225 persons being infected. We are seeing a steady trend for the past 5 years. And we must recall that these are just people that the PHIS, the Health Information System, is capturing, right?
Which means they access public health.
Right. And then we have those that are probably going privately and those that don't know, right? And for last year as well, we had a total of a little over 32,600 persons getting tested, where there were like 60% of the females getting tested. So for us, our motto for every year is like we're trying to encourage these males to come out and get tested.
Yeah.
Right? So we're trying to get there, trying to promote the events, and we're trying to encourage persons that it's not only for these events to come out and get tested. You can get tested on a daily basis at any of the public health facilities across the country.
Right. So, well, in terms of the program that we're having this year, again, each year, World AIDS Day, we're trying to do more dynamic programming, and again, to reach a broader base of the population. So we implement multiple layers into our programming. So this year, we're having the World AIDS Day Red Ribbon Solidarity Day. So within that program, we'll also be having the nationwide free HIV testing. At Belize City Battlefield Park between 9 and 3, we'll also be having games, freelance artists, they're going to paint HIV themed artwork ongoing. We'll also be showcasing our infections app, and we'll be having a commemoration ceremony for our HIV unsung heroes. This is a big program. What we did was we searched the country through our partners, and they suggested and we collected data on people who are not necessarily in the limelight, but they do the work every day, day in, day out. And so we're going to give them an award this year for the work that they do. So so we got some really good entries, and so we're looking forward to that on Friday as well.
Oh, wow.
Yeah.
Now, sir, good.
You mentioned that there's a disparity between women getting tested and men getting tested. So, as men, why do you think that's the case?
I guess as males, we tend to visit the health facilities until the end, until there's something really wrong with us. You know, and we're trying to change that mentality. All right. I mean, the test, as we keep saying on the show here, it's just like a 50-minute test. It's nothing. Everything is confidential. You come into the clinic, we do a pre-counseling, an intra, and we do a post-counseling. And 50 minutes finger prick, I guess us males would tend to, in the past you go and they withdraw the blood from the, and there's a whole process. But now it's but now the test is so simple. It's like you're doing a glucose test, and a pinch in the finger, and that's all it takes.
Right? And that's probably one of the most important facts that you have to get out, that we have shifted from the big needle going into your arm, because that seems to be a fear of many
and
people.
at that time, the process used to take like almost 45 minutes to an hour to get the test. So now,
During
15 minutes, you could get the test. Right?
Now, you've had dedicated programs, you and your partners, over the past couple of years, focusing specifically on men. And you've been going into workplaces where you have predominantly men. What has been the increase in terms of the number of men you've been able to test with this dedicated focus?
Well, we've gotten more men when we go where they are. Right. So basically, as Mr. Coyoc said, getting them to take the initiative and go to the hospital by themselves. Maybe time consuming for them, and so they don't want to do it. But when we go to the job place and we coordinate with the institution, we get more results. Obviously, we're bringing the stuff to you, so really little excuse there. But I think that still speaks to culture and behavior change, and I think that we still need to invest a bit more in that and recognize that healthcare is a part of our life and general healthcare. As Mr. Coyoc mentioned, the women tend to see how better health seeking behaviors, and so we need to kind of get guys to say, look, man, my health is part of my strength. You know, if I don't know what my health is, then how can I be strong? You know, so they're always tied into that concept of, if I don't know, it won't hurt me kind of thing, and that's a really dangerous mentality to have, because if you don't know, it can hurt you and others. You know, so.
You know, it's been a trend across the region, we know, that we are beginning to see more new infections every year, and it has become, I know, once again, a very important issue, a front burner issue when it comes to health organizations. I want to ask what we're doing here, perhaps, to address what we're now seeing in the trends, and what do you attribute as to why we're perhaps seeing more new cases now?
No, no. When it comes, I think when it comes to testing, you know, like Ms. Usher already mentioned, we're going out. You know, we're out there testing. So that's making us capture these people, right? These new infections. We're trying to bring more awareness, more health education, but as we always say, there's only so much you could send across, right? So by bringing this, by capturing these new numbers, I guess going out, more outreach, that's what's helping us to gather these new infections.
Yeah.
And what age group is more affected with the new infections?
For 2016, from age group 15 to 49 were the most infected.
15 to 29.
15 to 49.
49.
49, yeah.
Okay.
So it's still a youthful
yes,
population,
yes.
your productive sector.
Right.
Yeah.
So what we're doing in this case is like we're starting to target high schools, starting to go in and do health education, and some of the high schoolers that are already at age to do tests, you know, we're providing the tests for them as well there.
And when should you start getting tested for HIV?
Well, we use the age 16 years with parental consent, but at 18 years and above, you're entitled to do a test.
Now, it's one of the sensitive issues because even as we speak about this here, the main form of transmission is through sexual intercourse. Right. And it's not something that people feel comfortable talking about publicly. The counseling, the pre-counseling and post-counseling and risky behavior conversation that you have to have with people, how do you gauge whether or not your message has been properly received? You know, I've been through HIV counseling before when I go get tested, and it's very detailed, intimate information that you're sharing, and oftentimes you have to be warned about what you're doing right, what you're doing wrong. Talk to us about how that conversation unfolds with the people who come in to get tested, and whether you found that perhaps there needs to be new messaging.
When it comes to the pre-counseling, we have a form that we fill out.
Yeah.
And that's our guideline. All right. We ask you several high-risk questions, high-risk behavior questions, and that determines our level of counseling that we do. But from working at the clinic, because I used to work at the clinic before and sending the message across, I think people would leave from there with that message.
Yeah.
But like I said before, you're doing health education to a certain extent.
Yeah.
Now it's up to the individual, and it's on his or her onus to follow that advice that you give them or counseling that you do with them.
Yeah.
Behavior change.
And what about, okay, so you go in, you get tested, and you find out that you are positive. What happens then?
Okay. For example, like we're out at the outreach program, like for example at World AIDS Day, you're out there and you would get tested, and we don't usually say we don't tell you right there that you're positive. So we go like you're reactive to HIV, right? And to the virus, sorry. And then we would counsel you to come into the clinic. All right, so it's not we're trained enough to not to exaggerate out there. Oh, so everybody knows that you're. So there's a technique we use.
So what's the difference between telling someone they're reactive versus positive?
Well, the strips, what the strip does, the rapid test does, it confirms the reactivity, shows that their person is infected. But then we need to do a confirmation. All right, so that's the difference there.
Yeah.
So the person would come into the clinic, and then we would do all the follow-ups that's necessary for them. Yeah.
Now, let's talk about the quality of life of people in Belize who are HIV positive. And I think what you're mentioning is very important. You try to get them into a clinic.
Yeah.
What is available in terms of treatment?
In terms of treatment, all the treatments are, we have 2 regimens of treatment. I won't go in specific with the different regimens, excuse me. But treatment is available, free of cost. But that's where our main struggle comes in, adherence, right? You have these people coming in and they need to be on medication, and this medication is for life, right? So what we do is we try to counsel them. Okay, this is like you have a chronic disease, all right? Consider it that like you have diabetes or hypertension. You need to take your diabetic medication to keep your sugar controlled, hypertension medication to keep your high blood pressure controlled, your ARVs, antiretrovirals, to keep your immune system strong.
Yeah.
Right. So that's basically the message you try to send across to them. Adherence, and it's something I think that we should start incorporating not only the Ministry of Health but other entities. For example, human development, education, because these are entities that could input into these services as well.
Now, also with the ARVs, we know there are some situations where some people have spoken of building resistance for some of the ARVs that are available. Have we been able to address that situation?
What we do is, if there's resistance, then we would usually have to test first. We do the testing, the sensitivity testing. So once that would come in, then they would have the regimen. We'd change them from regimen. So like I said, we have 2 regimens, regimen 1, and then if there's different components in that regimen. And then regimen 2, there are different components as well. So if we see resistance to regimen 1, then we switch it to regimen 2. So there are other options on the regimens that you could switch to. That could be switched to.
And speaking of the adherence or the maintenance or continuously taking your medication, what seems to be the barriers for people in wanting to ensure that they take their ARVs every single day and take down their viral load and live a healthier life?
Some accessibility would be one.
Right.
But some people would tell
Why
you
it's only dispersed where?
It's at all the pharmacies, at all the different public facilities, pharmacy, you could get it. But some people would tell you, I don't want. I think it would be more inner stigma that the persons wouldn't want to adhere to the medication. Some people would tell you, from I walk into that clinic there and they watch me, then they watch me and know I have it, and then that's where again our counseling skills come in, So we try to counsel you, this is very important for you to take. You need to have your immune system strong and so forth. But what we do is we have integrated the services, meaning that you come into the clinic, you go to see the doctor like an ordinary person would do. You go, doctor, pharmacy, and lab works if that needs to get done.
Okay.
All right.
You mentioned stigma just now, and the truth is that there is still a lot associated with persons living with HIV. So how do you go about enlightening the public then to be a lot more sensitive to those with HIV?
A lot of that is public awareness campaigns.
Yeah.
Ultimately, we can't force people to think a certain way, but education and consistent and correct education and awareness will lead to that eventually. We have seen some changes. Actually, this World AIDS Day is 30th globally, because World AIDS Day was started in 1988. And so from 1988 to now, you have seen some changes in terms of public perception of the disease and those who have it and moving forward. Generationally, that does change as well, as people speak more about their sexual behaviors and more comfortable with that. And that has been the trend in Belize as well. The issue of whether or not stigma will or will not die down is there. We are dealing with it. I think all the partners in the National AIDS Commission are dealing with it in their own way, because we have a lot of tributaries and a lot of fingers on the ground, and everybody's pushing their message in different ways, but it's the same message. And so in terms of what we've been doing with the ministry, the ads and the ad campaign and the pamphlets and all these things that we're pushing out, hopefully will create some more change as we move forward.
Yeah, and I guess, and that's what we just health education, push until there's only, like I said, there's only so much you can do. It's up to the persons to decide.
The concept of behavior change, wanting people to change their own mindset. Now, it's so interesting if we look back and think of how much the understanding and the perception of HIV itself has changed. It is no longer considered a deadly disease, and you use the term chronic condition. That's where the rest of the world is perceiving this, because people can live with HIV a long, healthy life, but they have to do all the other work on the side, keep up a good diet, and take their medication. How do you use this example as to how the shift is taking place outside of Belize to kind of educate those who are infected? I still know of situations where people are suffering great stigma. And I've seen some of your messages, so obviously it's targeted to that you should still love your loved one, that you should still interact with them and not ostracize them in any way. So obviously we still are battling these issues. How do we help people understand that what we knew of HIV 15, 20 years ago is not necessarily, the technology and science has put us in a different place?
I think for us here in Belize, we need to work more on family support. Right? Family support is very important. We tend to see that those persons that have that support from their family are persons that are actually living in a very healthier way, right? So I would definitely target family support. I mean, we tend to have some persons would come in and they would be like, oh, you know what, my family don't want to talk to me, nobody from it. And those are the ones that you see deteriorate, right? So sending out a message, I would be like, family support would be the number one objective to try to target, all right?
What number of people die on average each year from HIV?
Last year we had a total of 101 persons dying.
101. And is that kind of the regular
it's like
trend?
like a regular trend.
And the reasons why they die?
Late coming in late to the clinics for
late diagnosis.
Not adhering to the medication. And those are two of the main components of that.
Now, when I think of that particular situation and how important it is to once again address the stigma that is associated, as Charlie was talking about, it means that the education that we have needs to be enhanced in some way. And I know you have tons of public education campaigns ongoing. You're going into schools. What are you telling them now about HIV?
Well, basically, the health education we do is we talk about the main components, the transmission and so forth, and we try to enforce more the preventative component, right? Because that's basically what we target, the preventative component, but not forgetting if you get infected, this is what's going to happen and so forth.
Okay.
Right?
Okay.
Yeah.
And I am aware that or let me not say I'm aware. I'd like for you to explain then. What are some ways that HIV can be transmitted for those that aren't aware?
Okay, so let me understand.
Well, it's on the screen actually.
Yeah, they can't read from that.
They can't read that.
Right. So, well, I think the main message is how is it not transmitted? Because people have a lot of misconceptions about the mosquito and touch the copper and touch your hand and all these things. And again, that feeds into the stigma, that feeds into where we're at. And then I think Mr. Coyoc's point to family is important. Belize is still a very much family-oriented system. And if you feel ostracized, the psychological damage is worse than the actual disease. And I think, speaking to that, I think that is where, in terms of the discrimination and stuff like that, understanding the disease cannot be transmitted these ways. The main transmissions are sexual activity, mother-to-child transmission, sexual mother-to-child transmission,
Blood transfusion.
blood transfusion.
Blood transfusions, yeah. So you can't get it from spit.
Right,
You can't get it from a
spit, can't
mosquito
get it from
bite.
touch your hand,
In
cough,
being in a room where there's a
right,
mosquito.
brush against their clothes,
Yeah.
you know, stuff like that.
Yeah.
So we want to dispel all these
Not
myths.
if they cough, not if they have a
Right,
cold.
and you know, we have a lot of these still out there.
Yeah.
And
I just heard the mosquito one.
Yeah.
really.
Yeah.
Yeah.
Right, and again, trying to work with these concepts and myths is difficult because it's passed on,
Yeah.
you know, and so again, it's behavior change, how we market, how we target, and in speaking to young people, the reason why we launched the app last year, it's a gaming app actually, and it teaches as well as you're having fun. So kids age 5 can play, you know. So again, and that's Belize and made. That speaks to our culture. You travel through the country and play the game basically, and so I think just how we target, how we message, but it's an ongoing thing.
Yeah.
And again, it's hopefully we make a big leap in the next.
Yeah.
And just to add, the messages we're sending it in different languages, right?
Okay.
Because you know we're
Right.
a melting pot of culture, as we always say, right? So all these messages that we send out, we're doing it in the different languages that we have in the country.
Now, where are the pockets of new infections? Where are we seeing higher rates of new infections?
The highest rates would be in the Belize district,
Oh, wow.
and the lowest rate would be in Toledo.
Okay. Is that how does that relate to number of persons testing?
It would be the population size.
Okay.
Right. Remember, the Belize district is the biggest district, and then the Toledo district would be like the smallest
in terms of population.
So in terms of population, that would be the reason why.
One of the key elements in understanding the progression of HIV or how one lives with it is understanding the viral load. And I know it's a very complex conversation to have, but it does, you know, we have all these times, these crazy stories about someone's been cured from HIV or there's
Bone
some
marrow.
yeah. And oftentimes, if you delve into the details, they're talking about a lower viral load or undetectable viral load. Can we talk about that? We do test viral loads in Belize.
Yes, we do.
Yeah.
Yes, we do.
So can we have the most simplified,
the most simplified
non-scientific explanation as to what that means?
Okay, the most simplified version of this would be, what's a CD4? CD4 would be your immune system, right? And then viral load would be the amount of virus you have in your body, all right? That's detected in your body.
Yeah.
So what's our aim? Our aim is to have a high CD4 and a low viral load, from 50 copies below to, as you rightly said, undetectable. So people might be saying, oh, you know what? How comes I know this person will live with this next person, but the man have it, but the lady don't have it? What is that saying to us? And that's the main objective of the medication, to keep the viral load suppressed or low. All right. So if a person has an undetectable viral load, it does not mean they're cured. All right. It just means that the medication is doing its job, having the virus suppressed so that the person is not able to transmit.
Yeah.
So if
Simple term.
if it's suppressed, you can engage in unprotected sexual activity with someone else and not infect the person?
Yes, you can.
Yes?
Yes.
Oh.
But we still emphasize use protection.
Yeah.
Right?
Yeah, because you never know.
Right,
You never
right.
know. How often should one get tested for their viral
Okay,
load?
viral load, we do it in the country. If you have your viral load suppressed or at normal range, we advise every 6 months.
Okay.
Right? So if you come to the clinic and you have millions of copies in your body, then we do it as a follow-up test. So probably like you would come and then like in 3 months we would test you again to see that the medication is working and there is progress.
Okay. Yeah. That was as simplified as it gets. Thank you for delivering that message. And it is key. And you know, I understand what Charlie is saying. And I was reading a story in about the United States where even medical doctors are changing their policies on what advice they give to HIV people depending on their viral load. But since we don't know who has tested their viral load, it's better to be safe.
And I'm glad to say, because in the past we used to send these tests out of the country, and now we have the machine in country, so we're working, yeah. And it's been we started doing viral loads in the country from November 2015, yeah. So it's continuous now.
And so besides the health fair, where else can you get a test done?
Okay, like I mentioned at the beginning, HIV tests are done countrywide. at any health facility that you go. The test is there, free of cost. As I said, it's only takes 15 minutes to do, right?
It's a prick on your
A
finger.
prick on your
We
finger.
could do it right now.
Yeah.
Yeah.
I brought my
You should have, yes, so they could see how easy it is. Yeah.
yeah. It's very quick. 15 minutes,
Yeah.
and as we're trying, as our message, our motto is, the earlier you know, get tested, the earlier you
Right.
know, the longer you live.
Yeah.
And what about mother-to-child transmission?
Okay, for mother to child, last year we had 0 babies being born to mothers that were
Yay.
infected.
Wow.
All right, but for this year, I think we're already at 1.
Okay.
Yeah, but again,
And what would be the reasons for that?
the mother booked. Well, she didn't book at the clinic. She just went directly to the delivery table, and that's when she got tested, and that's when she
Was
found
she
out.
unaware of her status?
She was unaware of her status. Yeah, but for all the other mothers that are out there that have been coming to the clinic that are positive, they've been captured on time, and medication has been given on time. So meaning that's where our babies are at 0.
And this is the show where science has taken us.
Right.
I met the most fascinating couple, 2 HIV positive persons who met at an HIV support group, got married, had a child, and the
Matchmakers.
child is negative. And that's where I began to realize that there's a lot you can do for yourself
Right.
to prevent it. How, if a female is HIV positive, and I can only imagine they feel they don't have children, they feel like, their world is over, their possibilities are limited. What should they do? Where should they go for information to find out about reproduction being an HIV positive person?
Well, all our health facilities have this information, right? So they're welcome to walk in, and if they need to talk to a counselor, the counselor is there. I mean, all the services we offer are free of cost. So it's up to them. It's up to their owners to come in and they discuss with us if they want. Yeah.
And for those who have not been infected, let's talk about what the risky behaviors are.
Well, then, I'll say normal, but it's not normal because people might not know. But multiple sexual partners, be aware of practicing better sexual activity. Make sure you use your prophylactics and everything.
So use condoms.
Use condoms.
Yes.
Right, don't use the big ones.
Preventative.
Preventative methods, right? Preventative methods.
Yeah.
Knowledge, I would say.
Yeah.
Make sure that you're abreast of general health knowledge.
Yeah.
Again, that does not exclude or include or anything like that, HIV, diabetes, anything, but it's good to know generally your health, where you stand, and try to protect that. But yeah, I think in terms of risky behaviors, that's the main transmission. We have the mother-to-child situation basically under control.
Yeah.
So I think right now in Belize, the sexual behavior and the transmission through sexual activity is the main issue.
Now, we know that in general, and if we look at our teenage pregnancy rates, we know that young people specifically, are not fully cognizant of how to protect themselves from HIV or preventing pregnancy.
Right.
So, and we still hear some of the very common myths and misconceptions. Your first time you can't get pregnant. If there's a withdrawal method, you can't get pregnant. But all of these things that contribute towards teenage pregnancy also contributes towards HIV
Right,
transmission. Given the situation where we have so many controls with young people as to what kind of information can be delivered, how do you get this message out? If you can't tell a young person, use a condom when you go into schools, how do you get these messages out? Because we do know they're having sex. If we look at the teenage pregnancy rate, if we look at the reports on initiation of sexual intercourse, we know we're looking at 14 and
15 to 4, yeah.
yeah, 14, 15.
15, yeah.
On average in Belize, just in case anybody still wants to dispute it. So we know they're engaging in activity in that they don't fully understand and they don't really know the threats that may come. How do you overcome that? How do you educate them with all these restrictions?
Right, I think that is a
Challenge.
that's a challenge on multiple levels.
Yeah.
As you said, there are a lot of restrictions. We have a lot of systems in place. it's somewhat of a battle of generations.
Yeah.
As we move along and as we do the dance of life, I guess we have to understand that we were all 14. We were all, you know, we went through this phase of our lives where we were experimenting and we were rebellious and stuff like that. And that is one of the main reasons why we have these issues. As we spoke, age 50 to 49 is our age range. That's not, that's by science. That's the age range where we practice.
Yeah.
And so to alleviate that issue and to try to target that issue, again, we're fighting, I guess, or we're conversating on multiple levels. Besides the awareness, besides the programming, you have like BFLA and these organizations who have youth arms and stuff like that, and they're trying to target this information to the young people. There are a lot of youth programs within schools, but again, like you have the Ministry of Education and these agencies trying to curtail information to the young people. But if we're not open to receiving these, and when I say we, I mean those above 30 who may or may not be able to see
Who seem
that
to
the
have
young
forgotten
people,
what
right,
14 and
what the
15
young
feels
people
like,
are
yeah.
dealing with, and addressing the issue at their level. Just because we don't understand the technology or whatever they're using doesn't mean that the messaging should change.
Yeah.
The messaging should adapt to the technology that they're using, right? And so we have to make our programming more palatable to the young people so that they get the message.
Yeah.
At the same time, we have to fight the upper level issues.
But let's. We know a part of it is the morality discussion.
Right.
You know, I don't want to leave unspoken words, as I said. So we know that the concern coming from the churches tends to be that if you tell young people about how to prevent HIV or pregnancy, you're telling them how to have sex. There have been many efforts in terms of engaging the churches themselves in the work of the National AIDS Commission, in the work of the Ministry of Health. What has that relationship been like at this point? And where are we in the conversation and having them understand that you don't necessarily go in and tell 14 and 15-year-olds, you know, here's your license.
Yeah.
What's the engagement like?
I think we have a pretty good relationship right now with the Council of Churches.
Okay.
They do sit on the National AIDS Commission and they provide sound advice and guidance. And they're in the discussion. I think they are aware of the communities they serve and that the collaboration has to be strong in order to bridge that gap. As we speak, actually they are part of our programming for World AIDS Day at Battlefield Park. So, and I think that, again, the information and the awareness within all facets of the society have come a long way. Understanding that we can't do it by ourselves. And so you have all the churches, the NGOs, the government, everybody, multi-sectorial, going across the board, trying to alleviate the issue. And so I would say that just as much as we've been changing mentalities with the general public, I think the same has been changing the culture, and the culture has been, in terms of the churches and the church-run institutions, has been changing, understanding that it's multi-sectoral. You can't fix it by yourself.
Yeah.
And I guess that's where it's very important where these health fairs come in. You know, if for example you respect their decisions and when it comes to their regulations at their institution, but when you come out into these health fairs, that's where we target. You know, we open up. Okay, this is what's going on. If you don't protect yourself, this is what's going to happen, and so forth. You know?
And so tell us a little bit about the fair on Friday, right?
Yes.
Right.
So on Friday at the Battlefield Park, we'll be having testing. We usually have the Kidney Association out there as the whole component for health. So the MCH department, the Maternal and Child Health Department. But there's going to be a lot of health education, right? We keep emphasizing this morning, health education. We just try to push as much as we can when it comes to that component.
The theme for this year is actually the right to health. And so speaking to the inalienable rights of everybody to have proper and accessible health care. And so that's what we're doing when we're doing this program on Friday. So the healthcare, the health fair, the testing, the games, everything will be HIV driven and health driven, and targeting nationally with all the other programs. We'll be doing the same thing. We do have an excellent partnership with some of our corporate sponsors, tying that in and generally making that a national issue again. As I said, corporate, government, NGO, church, everybody is tying together to make this issue a relevant issue.
All right, and the health fairs will take place across the country as
Yes.
well.
Let me just go over my.
Please do.
For Corozal, they'll be having their health fair at the Corozal Community Hospital compound, and they'll be doing a ceremony, 300 red balloons releasing ceremony. So they're inviting all the high schools from there. For Orange Walk, it's going to be at the Queen Victoria Park.
Yeah, I think that's
Yeah.
the name.
So someone's saying Queen
No,
Elizabeth.
No, it has like 3 names. Yeah, it has like
So
3 names.
I have because
Yeah,
just
so
so you
which
know,
one?
Queen Elizabeth, Queen Victoria,
Queen
and I think
Victoria. Okay.
Independence.
Independence.
Yeah, so it's gonna be there. It's gonna be held there, and then here in Belize, it's at the Battlefield Park. San Pedro, they're doing their health fair. Instead of doing it on Friday, they're doing it on Sunday because there's more people. They're capturing more people out there. For Belmopan, they'll be in front of the Scotia Bank. San Ignacio, they'll be at the Welcome Center. For Dangriga, they'll be in front of courts, and for Punta Gorda, they'll be at Central Park.
Okay. And so at all these health fairs, you can go out and get a free testing
test.
Right.
and all the additional information you may need to understand more about HIV.
Right.
And before we close, do we get to find out who some of the honorees are for today's ceremony?
No.
We don't get to find out even
One name, make somebody
There's a
morning.
big surprise.
Set me up.
We like the
Yeah, it's a bit of a surprise because they were.
But they know they've been nominated. No?
No, they know they've one or two of them know they've won.
Oh, let's
Okay,
find out one
well,
of those.
Yeah.
Because they've been privately nominated. We asked for people
Okay.
to nominate them from the community.
Oh, okay.
And so we want to keep that element of surprise.
Okay,
we
well,
call
then
them
we'll stop.
individually. And
So you're invited to come
so
out.
you guys can come out and you can see who won and why.
Okay.
And that's today or Friday?
Friday.
That's Friday.
Friday at
Okay.
the Battlefield
Friday.
Park between 10 and 11.
And from Belize City or the entire country?
It's from the country.
Okay. Well, that's good to know.
Yeah, and we also to mention we're having for the Belize district we're having different events happening all week. You know, we've been out testing at different facilities, entities. We've been to Bowen and Bowen, BEL. Today we're doing city council, so we're trying to have the entire everybody that works there for them to bring them in so they could do their tests. And we've been having, for example, tonight we're having a client appreciation night. You know, for these persons that are infected, for them to come in and just have a little dinner with them and so forth. So there's a lot going on. All right?
Yeah. So what's the total number of persons living with HIV in Belize?
The total number, it's 3,665. I usually tend to lose my numbers. So much.
Thank you so much. And for those people, we hope that they continue to take their medication so they can have the best quality of life that they can, and that the rest of us will understand more about our role in supporting.
Right.
Thank you once again for being here.
Thank you for
guys
having
for
us.
having
All right, we're going to go ahead and take our break. When we come back, we'll be talking about how to teach your children about good touch, bad touch. So stay tuned.